Good evening again. This is Dr. Bill Wyatt with the American Orthodontic Society, and it's getting a little late at night to do this, but anyway, it's a quiet time, and hopefully it'll be quiet. I wanted to talk to you some about mouth breathing. To me, it's one of the big causes of problems with orthodontics, and also with retention and breaking down like that. So if you're a chronic mouth breather, it affects the way your teeth grow, the way your facial structure goes, has a whole lot of effect on your life. And I would recommend you get a CPAP if you're a mouth breather, especially at night, I use one every night nearly, and it has a great effect on the oxygen that your body takes in, and you have less problem with urination and things of this type as you get older if you actually do use a CPAP device. It forces the air in, and that makes the difference in there. So anyway, that's my suggestion, and if you can, go have your whole facial structure reshaped or modeled, and that's what we try to do, and that should be done early in life. I mean, when you see the child is breathing through their mouth, you take them to the ENT guys, and some of the ENT people used to spray their nose out and get everything shrunk down, and then they could breathe good. They said, well, you don't have any problem, but you do have a problem if you're breathing through your mouth. You just have problems that come up that you can avoid, like, when you breathe the air through your nose, you suck it through a filter, the little cilia in there. You filter it. You moisten the air to the regular amount of moisture that it should have to get down into the lungs, to not dry the lungs out, or not dry the back of your mouth out, as you do when you breathe through your mouth. You wake up and your mouth feels like it's leather in there, so it has an effect that way. When you breathe through your mouth, you just kind of just very slowly breathe, and you can suck air in just real slow, but the air needs to go in faster, so your nasal capacity is kind of like a carburetor. You gotta put a little suction on it, you see, and the air will go out and then get swept out into the different portions of the lungs there, and the exchange oxygen and carbon dioxide is much better, and a person will have a higher oxygen blood level if they're breathing through their nose, especially important for children. And there's probably another good effect of it. I know I had a young man one time. It was just a kid. He was just, I think, 12 or maybe 10, 11, and he was seeing a physician because of some lung problem that he had. And this young man was a mouth breather. So he had, his maxilla had shrunk down because of this. Now, I went in and we expanded the palate of this young man. We spread it out, and as it goes out, and you put some buccal root torque on the teeth, and you get them out here, and you make a opening in there that is much bigger and is harder to close by some allergy. We've got so many things that we're allergic to nowadays, and if you're really bad allergic to something, the tissue around the terminates swell up. Let me get into some pictures here that'll I can talk about that. Maybe you'll understand a little better. I really want to sell the idea of, if you can't breathe good, have something done. If you can't get it done proper, or if you do it and you still are breathing through the mouth, get a CPAP and breathe through the CPAP. Your oxygen level is much better, and I know for a fact you have to get up a lot less if you're using a CPAP to go eliminate your urine. If you've got a child that is wetting the bed, I'll guarantee you that this child is usually breathing through his mouth. And if you get the airway opened up, and don't wait till they're 14 years old to do something like that. We'll get into this on the pictures here in just a few minutes, if I can get this thing working. Now this is just a x-ray that we just stuck in somebody's mouth, and we will just, it just takes this, you just put it in like this and you shoot right down through the nose, and it'll give you a good view of the palatal sutures that hold the palate together. Now, these sutures have no really feeling in them. You can crank on them and put pressure on them, and if you do, they'll separate and come apart, and you can widen this out any amount. I say any amount. You can widen it out to what you need to have airway. And as you carry these teeth out like this, you need to be carrying the roots out on the teeth. So we like to band every tooth that we do. The molars, I usually just carry the second molar out, and the separator is usually right opposite the molar, right in here, and you'll go up here like this back, and then you'll have a deal go on to the bicuspids over on the other side, and your separator will be right in here. And we made our own separators and developed them out the way we wanted. And you band these teeth, and you get them fully banded. Well, the first thing you do is separate these teeth really good. And now you come in and put bands on them that fit up on the tooth, that go down on the tooth. It's real solid. And I want to emphasize that you definitely need them banded, and they need to be cemented on every tooth. And I've got a few pictures of one just having a band on this tooth, and a bar out here, and a bar over here. And you're pushing this tooth out right here with just a bar. It's like having a bicuspid something sitting here. And you push against this bicuspid right here with a bar. What's that tooth going to do? If you look at it from the side, this tooth is going to just tilt over in this direction, and it probably will rotate around something. So this part of it may go in and have less airspace. And so we want to carry this tooth out bodily. And you go in, so we recommend you put some buccal root torque in it to keep carrying this out at the same speed you carry the crown out. And that's what we recommend, and you can make the airways big enough in a lot of people to they can be allergic to something and still have room to get air through. So that's something you might think about. I'm going to go on here to the next picture. Now, this is the normal separating device that we have. And there's a bar through the middle of this thing, goes over here like that. And it runs down through here. It's got threads on it. And it'll have a hole in it here and one in the top and one in the bottom. In other words, you can stick something through it this way or this way. This would be a hole over this side. You make darn sure if you're making it that you go in from the front and then you lean it back like that. And you open a 1/4 millimeter with each quarter turn that you open. You turn that palatal separator. And we usually cement them in and let them get good and solid. And then we'll do about a couple of turns and then let the person turn them once a day anyway, and come back in a week and you look at them and make sure they're turning it. And if they're not, you have to see them every day and turn that thing. And you put pressure on these teeth right in here to go out in this direction. And if we band these teeth, I mean, you really put the thing on proper, the tooth will be locked in there and it will go apart. It may tilt a little bit as it goes out, but then after it sets there a little bit, it'll bring the roots out too. But if you just think you're going to put some acrylic deal in here, or you're going to put one band on here, just have a bar on these, and you go apart, this tooth right here will just lean out and you will not get the airway developed like you should. And so this is something you really need to understand and do. Let's get over with this. We're getting late. Now here, this is just some pictures of a real skull. I mean, this is not a plastic thing that somebody made. You can't duplicate a skull. I mean, it's just too complicated. Here is the lower turbinate, the middle turbinate, and the upper one is pretty small usually. And this is the nasal septum. It comes down through there. And this is going down here, and your upper front teeth are sticking out here. We'll get in here and show that a little bit better later. Now here, we're just looking straight at the facial structure, and this is the nasal septum, and it's kind of slipped off here. When you separate the palate, the septum goes to one side or the other. I don't think you split it at all in here. And anyway, where this one is, there's less room over here, and there's more room over here, and these can swell up in here and just virtually stop the air from going through that space. So you can I do this frequently, just keep saline water in little plastic jugs, and you can press those things and it'll send that saline water all up one nasal opening and down the other, and you can go back and forth with that water, and it'll loosen up a lot of stuff and get it out of your nose to clean up this area so you can breathe better when you go to sleep at night. That's when you start getting having mouth breathing problems. A lot of people breathe through the mouth during the day and then breathe through the mouth every night. And when you breathe through the mouth, I don't care who you are or how important you are or how many degrees and everything you got. If you breathe through your mouth, you're going to breathe on top of your tongue. Your tongue's going to be sitting down in the mouth like that, and it'll be up against the teeth. Let's get a little better picture here. This is just the upper arch, and it won't tell us that. But if you put the lower teeth down here, we'll get something here in a minute. Maybe I could show you a little better. But people who breathe through their mouth constantly or quite a bit, their upper teeth do not expand out over the lower teeth properly. And you ask me, how do I know that? Because that's the way I have been breathing for years. And my upper teeth aren't wide enough now, and my lower teeth are a little wider than the upper teeth, and I bite my cheeks. I'm going to show you that a little bit better here later. Now this is a little deal, just keep that on. And you just need to understand the sinuses. This is the sinus cutaway. And this is your frontal sinus right here on each side. And one of mine was stopped up and stuff had dried in there. They had to go in and operate on it. They opened it from this side to the other and they flushed it out. So at night I flush that as much as I can. You can take a hot washcloth with just about as hot as you can stand it with your hands and get water on, don't wring it out. And just hold it up to your nose and suck some of that steamy water up in the nose. And it seems to loosen up stuff that's dried in there during the night or during the day or whenever you go in there. And I did that. I'm stopped up right now, as you can tell. But tonight when I breathed in this hot, steamy air, it loosened that stuff up and a whole bunch of it just cleared out. But I've still got some of it in there. But this, you need to understand it. You have to take care of it yourself. Nobody else is going to do it for you. And so get you some of these little bottles that you can fill them with saline. You can give you a little bit of salt, and you pour that in there with the still water and shake it up. And I keep 2 of them full, and I just press in there and flush the nose out at night. Now, once you get it flushed out, if you spray it a little bit, they've got where you can spray once a day and you won't get allergic to the spray. But if you get allergic to the spray, it'll stop your nose up worse than anything, you see. So I do that once a day, and sometimes just leave it off and go ahead and hook up your CPAP, and I keep mine on. And you put water in the CPAP, and it'll evaporate quite a bit of it during the night in there. And just breathe through your mouth, you see. Now, when I wear the CPAP, I have my mouth closed, and I don't do the things. If I don't do that, I've got my mouth open like this, and it stays there with the pressure, so it makes you say, well, your tongue can't move your teeth, and you just couldn't be any wrong. Your tongue can move your teeth all over the place if it's used in a certain way. And I've said a man that's 50 years old that pushed a lozenger up in the roof of his mouth to stop smoking and pushed his front teeth out. And it pushed the teeth out there where there was no bone, and the teeth moved, and they carried their bone with them just like he was a kid about 5 or 6 years old. All right, let's get over taking too much time here with this. Now, this is from the back side. I'm looking in from the back side of the mouth now. And here is the septum down through here. And this is the top turbinate, it's small, and the middle one, and this is the bottom turbinate. You have three of them. And the septum, if it's deviated, and I'm sure that during my lifetime I've been hit several times pretty hard up here, and I'm sure the septum is bent over to one side or the other. Playing ball, I nearly got my jaw knocked off by a big old guy's shoe. And I thought my jaw was gone, but it was. So I've been through that, and I've been boxed and hit in the nose, and so your nose gets some pretty bad care during a lifetime. When I was a kid, I was trying to walk on a barrel. It was laying down on its side, and of course the barrel went one way and my feet went out from under me, and I came down and hit that barrel with my front teeth, and it cracked the enamel on them. But the teeth are still there. The enamel still stays on the dentin, but it's got a faint crack in the enamel. That's something that can happen. All right, let's look at this other part here. Now here is where there's a guy named Timms, I believe, that wrote the book on palatal separation, and they usually band this tooth right here, and then you'll have this gadget right in the middle of the mouth here with a screw in it, and you'll have it, it'll be separated like this, and you're going to crank that thing apart, and you'll have some go out like that, some will come out and go along these teeth, and I like to band these teeth if I possibly can, and you've got this pushing about the molar area. Now the bone structure right in here is pretty thin, and it can go apart pretty easy. But here, the bone structure is considerably more in the anterior part of the mouth. Now, I saw Dr. Timms at New York years ago, and he had written a book on palatal separation, which he did a real wonderful job for dentistry and for the health of people all over the world that use a palatal separator. You can restore kids that breathe through their mouth all the time. Their palate just won't develop. It'll be too small, and then you need to widen that thing out. Now, once they get older, it's a little different process. I asked Dr. Timms how old he could open anybody's sutures and open the mouth. And he told me, well, about 17 or 18 years is about as long as I could get the sutures to open. And there were a lot of people standing around there to talk to him, so I didn't say anything, but I just left. Because I had been opening people in their 30s, and had a few of them I could open in their 40s. Well, what was the difference in what I was doing and what Dr. Timms had done? He put the load right down here on these teeth. It's going apart. The main part of the bone's right in here, see? But when you're pushing apart here, the big part of the bone is down in this area. And this won't come apart on people when they get 20 or 30. Same thing as this young man that I've got a video on when we found out we could not get this to separate. I put all this pressure and it didn't separate. So I came in one Saturday and I put a spring between these teeth. I mean, it was strong. And the guy left with this young lady with him, and they went downtown, and they came back about 2:30 or 3, and this palate, the suture had separated. His girlfriend told him, says, hey, your teeth are apart up there. And he said, I didn't feel a thing. The teeth went apart, and you could stick a big old wooden match right through in between the teeth up there. So ever since that was about 40 years ago. And I have lectured on this and talked about it and written about it and everything you can think about, but people still don't do it. And so I want you out there, I don't know who you are, you're looking at this thing. We have thousands of people that listen to this and look at it. Start using force in the front part of the mouth out here and use the force back here. And you can open people in their 30s, and you can get some of them open in their 40s. And if you can't open them, you can put a big archwire on here, or you can just take the palatal separator and just keep it on there. I've got a video on a guy who was, he was just almost 30, but he weighed 312 pounds, and it wasn't fat. I mean, he was a muscled up, I mean, he was a big man. And I was trying to open his palate with a suture deal in here, and I put a deal on the front teeth out here, and I still could not open it. But I just kept it there, and he didn't mind it, the pressure. And the pressure on there widened his upper arch to where it was back over the lower arch. Now this guy, it was inside, the upper arch would close inside the lower arch. And I've got a video on him if you want to look him up and see it. I put pictures of the darn thing. The bone structure in the roof of the mouth looked thinner, but then once you leave it there for a little bit, it'll thicken up and everything. And we widened that guy's mouth out. Now I've got a lady, a lot of them that we have done adults by just putting a big archwire in there and expanded, tie it to their teeth, then put another arch in there that's got buccal root torque, and you forcing the roots out and let them wear that. This lady, I just did a video on her just a few days ago. She worked in the office and everything, and she had a narrow upper arch, and when we got through with her, it was something like that. We pulled it back, and it brought the anterior teeth back too. Go down. So we can widen just virtually anybody's maxilla and get it out there whether they can breathe if it's possible. And I want people to learn how to do that, because there are a lot of people in this world running around with a narrow maxilla, and they will not be able to breathe through it with any little something will stop it up. And they need it widened out as big as they can get it. Let's go on now. This is another shot. There's the three turbinates and the separation. Now there's kind of really your separator is right off from here. It's more here, and you go up and turn on here, kind of turn on this part right here, and then you put something out here on the deal. Except have been using the teeth to push apart, and the teeth are in the bone up here. And I'm thinking that it would have been better if I had put two tads in the bone structure and put a sliding archwire between them and put the pressure on the bone rather than the teeth. And I think we'd have a better chance of putting more pressure and getting more of these separated. So if you get somebody that's really bad like that and they want to try this, then go ahead and do it. And I did it on somebody who just wanted out, I put the separator out there, and he was griping about the pressure hurting, and I put that spring on. Once the suture separated, had no problem with the pressure. They don't have the pressure on. All right, there's another view of the turbinates. I hope you get a good view of them. And this is the palate right in here. See? And here's the main one, there's another one, and here's a little bitty one over here. And they separate, and the airway is going down through here, and you get this whole thing pushed over this way and that way. If you get the hole big enough, you can get some allergies and still breathe through the nose. So that's what, and the lady that worked at the office, she had huge turbinates, so she got an ENT guy who we had worked with to come in and reduce the turbinates. They can come in and freeze this part, and then it'll just peel off and just reduce the size of the turbinates. You don't want to reduce it too much. You want to keep the air going in like a carburetor there on that. So here again, it's just, I think we're looking at the turbinates through this part up here, and that's confusing. This is the inside of the mouth, and there's your wisdom tooth, the 12-year molar and 6-year molars, the two bias, the cusp, coming across there. And so we have done that. Now there's another shot of it. And there it is again. And that's, okay. Now that completes this. When I wanted to look at the skull. Now if we're a chronic mouth breather, you do not bite together when you close your teeth. A chronic mouth breather frequently will have an infantile biting process, and you probably can't even swallow that way. But I've shown people you pull your lips together and you keep your teeth from touching, and you swallow that way. When you do that, your teeth don't get this pressure constantly, and so the teeth move toward one another. And as they do, you get a longer lower third of the face. And this, if you increase this length down here, say a half inch or even less than that, it messes up the appearance of the face. It really does. And so I'm going to say goodbye, and we hope you'll subscribe to this YouTube channel that we have, and I hope it does some good. We've got nearly 5,000 people out over the world somewhere. I don't know who you are, or I would like for you to write back and tell me what effect or what you need to know. And I'd like to be able to look you in the eye, but I won't be able to do that. And I want you to learn orthodontics and do a good job for everybody you work on. And I'm going to hang up here today and hope to see you again later on. So thank you now, and I'm going to close down.